I think we almost got everybody back. Yes, everybody made it. Their speaker.
There you go. There's your sound. Now click on the screen again. Right, and hit mute button. All right, it's the first one there. See?
Hi guys, long time no see.
Hi.
Yeah, we're just waiting for Dr. Houdek, and I think we got everybody back.
I'm going to mute mine.
Okay. I like Janet's smile. It's so sweet. And Kelsey made me laugh last time. Remember Kelsey with the short hairdos? Oh my God, that's an inside joke between us, but we'll talk about that later. Oh boy, you guys are awesome.
I mean, I can say that. I think us chronically ill folks tend to have short hair because it just gets to be too much of a hassle at a certain point. We're just like, no thanks. Shampooing my hair for like an hour sounds like a bad time.
Yeah, I'm about ready to, after the meeting ends, I'm going to go get my hair cut short. So
I'm going tomorrow, so how about that? Oh, there he goes. He found us. Hi, doctor.
I'm back.
All right, now we can continue. So whoever has questions, take it away.
We were talking about the LASIK and the glare. And as I was saying, sometimes this aberration comes. The other thing is I had LASIK 20 some years ago and had the monovision too. And the distance sometimes, as we become more mature, that little monovision isn't quite what it should be. So it's like when I drive, I have my glasses, just a plain lens on one side, and I correct my near eye for the distance. So now it puts both eyes on the same plane, and I can see really, really sharp that way. I've also become a lot more mature, and I use these for some of the reading that I have to do. Like this with looking at the computer, I'm fine, but if I get something up a little closer, that maturity hit me. And so I have those reading glasses. But it could be you might just need some glasses for full distance, and that'll take care of it. Okay, I think we're for sure.
I'm thinking that's my problem is it's usually like in dim light and far away.
Yeah.
That I have the issue.
Yeah, just get a pair and put both on the same plane.
Okay, thank you.
Kind of a follow-up. Oh, sorry.
Go ahead.
I was just gonna say, do you usually see like degeneration with people who have had amblyopia as they age? Like, is that pretty common? Like,
it can be, just depends on the person. Most of the time we'll see a little bit. If you're under stress, strange stress, it's going to break down. And so it's a surgical thing to align the eyes, and it can break down under strange stress. Sometimes we just give them some little eye exercises, some therapy. I mean, one of the best ones you can do, and everybody can do, is just eye rotations. Now, this is not like when you were a little kid and your mom said something, you went, yeah, sure, mom. What you want to do is you want it to look up as high as you possibly can, look to the side, look down, look to the side, and just roll those eyes 4 or 5 times one way, 4 or 5 times the other, just to stretch the muscles, because we're just up here too much at that work. We want to stretch them. Another thing they've come out with is something called the 20-20-20 rule. I'm not sure if you've heard of that. The first time I read about it, I thought, who came up with this crazy idea? And basically what the 20-20-20 rule says is when you're doing a lot of close work or reading, every 20 minutes, take a 20-second break and look at something 20 feet away. And I thought, not a bad idea, but completely impractical. What am I going to do? Put an alarm clock and set it for every 20 minutes and look? I could be on my computer for 2 hours and think I was on for 20 minutes. And I'm thinking the reason they came up with the 20-20-20 thing is when you hear 20-20, you think of your vision. So they threw the extra 20 on it just to get you thinking about the vision on it. So it's something in your head. But basically what you want to do is every now and then, go ahead and take a little break. 20 seconds, 30, a minute, look at something far away. I tell people, you can even just close your eyes and think about looking over a big lake or at a mountain. You want to relax them just a little bit every now and then. Looking out the window is excellent, just to give those eyes a little bit of a break to go. Because like I said, this is work, out far away is relaxation. We just overworked our eyes.
I have a question about what you just said. I have blepharitis, so it's like a two-part thing question. When you were describing that, are you actually just going in a circle? Like you're looking up and then you just follow the circle around with your eyes? Or are you going to like the top point and then over 90 degrees and looking at that? Or
Yeah, some people they're having a hard time doing circles. I have some people that kind of go, and I'd say roll your eyes in a circle and they'll look up and move their mouth and their tongue all over the place. They just can't do it. So I say, then just look up as high as you can, look to the side as high as you can, or pick out 8 points around. But rolling the eyes, just getting a nice movement as far as you can, just to relax them.
okay. The second part of it is, and I guess you could just give me your opinion or your thought on it. I have blepharitis, and recently what I've been doing is looking after I have to do the eye soak with the baby shampoo thing, and every day. So after I do it, I look to one side and then I come back to the center. I hold it for 2 seconds, each one. I look at the, out straight, then I go to the left for 2 seconds, back to the middle, 2 seconds, to the right, 2 seconds. And I do that X amount of times. I just started doing this recently. And I don't know if I'm imagining it or what, but it seems like it made my blepharitis better, each day. So do you think that could have any role play in that?
Yeah, that's a good question. That's with the blepharitis, it's the warm compresses and wash really works well. But just rolling the eyes, I mean, fatigue can set in, and if by rolling the eyes, it kind of, like I said, it relaxes the muscles so that now the eyelids aren't coming down. I'll just explain blepharitis. If for those that don't know, is like a little eyelid infection that we call it. It's more in the eyelashes that happen. And I'm going to tell you, when I was a little kid learning this, they told me it was maybe 10, 20% of the people have it. I probably see it in more like 60, 65% of the people that my patients that come in, they don't even know they have it. And saying it's getting those, I ask people to get that little dry eye thing in the morning, a little crustiness in there, and saying that's all causing it. The little flakes on the lashes. Now, the one thing you said you use the baby shampoo, and I've gone away from baby shampoo because what it says is it says no more tears, and I said for me it should be one less tear than the others. I mean, it's still, I've used it and it burns my eyes. They actually have some soaps designed for the lashes that are a little bit more effective and less stinging, less burning. One's called OcuSoft, OcuSoft, and you can get that in little pads or little bottles and spray it. We had one patient, she bought a big bottle of it. She says it cost her $25 and it lasted her over a year. And you just don't need very much, but just cleaning off that little gruff that's on there. Now, one of the other things you're going to love this with blepharitis is one of the things that's very common is actually it's a little mite we call Demodex. Now, you're supposed to have them. These are little things that live in the deep in the lash there. You need them because they get rid of a whole lot of other things. It's kind of like your gut bacteria. You need gut bacteria to help digest everything. If you get too much, it's bad. You have enough, it's good. Same with these Demodex, and we see a lot of people that there's too many. The lashes are too oily, and that holds them, covers everything up, so they kind of proliferate like that. Well, you just want to hot compress is the best. The heat, I tell people also at the end of your shower, just gently massage your eyelash line, right on the top, right on the bottom, and just kind of wipe away. Now, if you do it kind of really daintily, doesn't work. You want to have a little bit of pressure, but do not poke your eye out through your ear. We don't want that much pressure, but just rub there to break down that oil so it flows out well. I tell people, you wash every other part of your body. What about your eyelashes? And they go, oh yeah, I wash my face. And you do this, well, you never get your lashes. And so that's when you want to wash the lashes. But-
Well, go ahead. You were going to say
Yeah, go ahead.
something. I do, when I say I use the baby shampoo, what I've been told to do, which I've been doing for a lot of years, is you make it's like 1 to 3 solution.
Yeah.
And then you dip a Q-tip in it after you do the warm soak. And then you go under, like you lift your eyelids up and you follow that lash line along inside to wipe off the oil. So that's how I do it.
And that's good. I've just had too many people when they've tried it with the lash and they pull their lid down, they've come in with scratched corneas.
Oh,
And they moved it and I say, I kind of got away from that. And I said, just on that lash line and saying, doing that. And that oil breaks up, it starts to liquefy at about 108 degrees. So it depends on how hot your water is coming out of the shower, or if you're not having that, I tell people, if you want to get a little bowl of water up in the microwave, when you can touch it with your wrist, then you put your rag in there and get that, massage that with that warm, moist heat and get that off.
Oh, you massage it with like the washcloth on
With
it?
the washcloth, yeah, just get that cloth and just massage with that cloth. In the shower, you can just use your finger because you've been in right there.
Well, in the shower, then you wouldn't have anything to like move it along the lash line, right? It would be,
Yeah,
or
just
do
your
you
finger.
put
If you've heated it up, just using your finger, that just squeezes it all out. And then when you get out, when you're gonna wipe it off with a towel, then just same thing with the dry towel, just wipe it right off.
Oh, okay. All right.
Yeah.
Thank you.
And a little bit easier.
Yes, thank you.
Okay. Any other questions right now?
I had a question. Is it true that people with fibromyalgia, they tend to get change prescriptions often with their glasses or get stronger prescriptions? In your opinion, doctor?
Yeah, great question. And I've not seen that. You can have variations, I mean, from day to day, just because of the fatigue on the muscle, your focus muscle, and saying, but not a lot of change in prescription. And I said, but it's mostly the close work. If we're fatiguing from that, we might, for fibromyalgia, we may give them a little bit stronger reading ad just to try to relax them a little bit. Or even then, I just still use Prism, a little bit of Prism just relaxes the eyes enough to get rid of that strain stress. I like calling them stress reduction lenses instead of reading glasses. Sounds better. Okay. Any other questions?
I just have a quick one.
Sure.
Retinal migraines. Do you find that it's caused by possibly your prescription not being quite right? Or is it just something vascular?
More vascular, prescription not being right can, if it's not right, rarely we're going to get retinal migraines. You're going to get more fatigue, strain, stress with your eyes. But again, any kind of strain, stress in your body can create retinal migraines. There's a group called the Brain in the News. I subscribe to their articles, and it's great. Every month they have a little thing about something about brain. And a couple of years ago, they were talking about migraines and ocular migraines, and they said everything that we know, we've got a lot of research in here, and they wrote an editorial and saying, and we don't know a whole lot more than we did about 20 years ago. And it's still, what causes it? Everything, any little thing. We haven't had a good pinpoint on a lot of things yet. But any way to reduce strain, stress in the body can reduce that. Fatigue, dehydration. I've been on vacation and I've had retinal migraines, being relaxed and saying I shouldn't be that kind of stress, but even good stress can cause those. But I'm also a migraine patient.
Yeah, I was wondering if like high blood pressure, if
So
you have,
if it's uncontrolled, yeah, you want to, yeah, not, we don't say there's too many medications that cause it, but other, if the strain stress on the body can.
yeah, at first, when I first got it a few years ago, I thought I was going blind. Right away, I called the ophthalmologist and came in and he looked at it and said, you're having a retinal migraine. It'll be gone in 20 minutes. And it was.
Yeah.
It's like,
Yeah.
so,
Some of the, what about retinal migraine, for those don't, it's a little auras in your vision and little kind of like little lightning flashes, or you can get this sometimes it's blind spots in your vision
Yeah.
or little different things, spots, and say, no, boy, I can't see. When I get mine, dead center, a little spot is gone. And so whatever I'm looking at just isn't there. And people say, what do you see? And I say, nothing. It's a silvery grayish blob, but I can't see it because they can't look at it. It's gone. And it's not in the eyes, it's actually in the brain that goes on. Though you can also get little things. Once I had one, it was gorgeous. It was this, if we took like 20 straws and put them and made like a little geometric figure out of it and just rotated this thing, and all the straws were changing colors at the same time. And it's just little things sitting in front of my vision going, whoa, that is really kind of cool. My wife goes, go take your pills. I go, not until this one's over. This one's really cool. You know, because it takes me 3 hours to get the headache. So I said, that one's cool. I said, sometimes but as long as you know what they are, and because other things like a retinal tear, retinal detachment can also give you these little flashes and stuff around. And if you start to notice your peripheral vision, something's just not right, and it's lasting more than 20 minutes, you want to get on the horn right away and call your optometrist, ophthalmologist, and get that look. Our instructions to our staff here is someone calls in and say they see something in their vision, it's floating or lights flashing, and saying, you got to bring them in. We got to take a look.
Yeah, I have like lightning bolts.
Yeah.
And I can't see. It's like, I know it just happens out of the blue. I don't know what, when something hits, like if I'm driving and it hits like chrome on a car or the light and it goes into my eyes, sometimes it'll trigger it, which, you know, but like I said, it doesn't last very long. I usually pull over and, you know, and within a few minutes it's gone. But
Yeah. Bright flashes of light, smells can create strong smells, noise can create that, dehydration, that happens to me a lot. I kind of get crazy. I forget to drink water or have food. I can get up in the morning, have a cup of coffee, and, you know, realize at 5 o'clock I didn't do anything. You know, I didn't take anything else in, and saying, yeah, that's not good for the body. And that can create it.
thank you.
You're welcome. Anything else?
Yeah,
have a
I had. Oh,
I'm sorry.
go ahead. Go ahead.
I have a question about TEDs. You hear that on the news a lot lately with the commercials about thyroid. A lot of us are on thyroid meds. When we have the swelling in the whites of our eyes, and it's not necessarily always red, is it dry eye, or what's the difference between TEDs and dry eye?
TEDs can create dry eye because it swells and your eyelids then will not blink over your eye, and that'll dry it out.
Okay.
So if you're getting that swelling without the redness, you still want to use artificial tears, and you may want to go to the heavier oil-based tears. One good one is the Refresh Mega 3, and that has omega-3 fatty acids in it, which works very nice. There's another one called Soothe XP. It's extra protection. These drops, though, when you do put them in, you will be a little fuzzy for a minute or two just because they're a little thicker oil, but it coats well. Some people have to go to a gel type of a tear. That lasts a little longer. And then at night, if your eyes aren't closing, we'll either go to an ointment or try to wear a sleeping mask.
My doctor never says it's TEDs, but then when I deal with the sleep apnea people, they say have your tubing heated for some reason there's a connection, I think, between nose and eye. And that's my main problem, is the dry eye that I'm getting created from maybe the device being lacking, that it's allowing, you know, the air to hit my eye too. But I do the dry eye, but that's why I was asking about this MSM. There was something something that's available at Walmart, MSM eye drop and OCLUMED, following the MSM drop, that people are saying that in addition to whatever for dry eye, that this is like a godsend, but I don't know that much about it yet.
Yeah, that actually, I'm going to tell you, that's new to me. I've not heard of the MSM drops.
Yeah, so I'm just curious. Yeah.
Yeah, that's new to me, and saying it's, yeah, I'm going to look that one up afterwards.
We're going to ask Bob's retina specialist today too, but we're leaving the meeting early because we got to go with him. But anyway, I just have to ask you too. Thanks. Appreciate it.
You're welcome. Any other questions?
You know, she mentioned, oh, go ahead. Whoever was there.
Sorry. Oh, I was just gonna ask about in terms of you said you experienced migraines
Right.
and like obviously like noise reduction, like staying in a low stimulation environment can help, but like in terms of trying to live kind of like everyday life with those things, is there anything you found to be helpful? Because I feel like I'm already doing so many things to do reduction, and it's just there's no way to avoid that stuff. Like,
And yeah, some of that, I mean, talking to a neurologist and saying that's, and some of it, I used to pay attention to it. Now I just kind of wait for it to happen. It's now it's kind of funny because for a day or two, sometimes I get a really little strange feeling in my body that like I'm really not me or something. And it just feels bad. So then I will even take Excedrin migraine because caffeine in high doses can reduce that. Do you drink caffeine at all?
I mostly do tea now, but
But
I
yeah,
have pills that I'll take that are like low dose caffeine.
yeah,
'Cause
but
of coffee.
caffeine in low doses can create headaches. Caffeine in high doses can get rid of them.
Really?
So that's what
What
Excedrin migraine has a high dose of caffeine in it.
what do you consider a high dose?
More than a cup of coffee.
Fair enough.
Let's say.
Yeah,
So
I've had hypertension in the past, so I've just, I try to be really aware. It's been
yeah,
fine, but it increases with pain.
yeah.
It's been low, good for a long time now, but yeah. So I don't know the caffeine intake stuff along with all the other stuff.
Some of the actual prescription medication has caffeine in them, and saying doing
Okay.
it, and saying if you're in a bind, if you're out someplace, get a Mountain Dew. And Mountain Dew, it's one of the highest caffeine drinks out there, more than most of the energy drinks.
Jeez.
And
Yeah.
crazy on the sugar, but it's got that caffeine in it for you.
I'll keep that in mind. And then the second thing I wanted to ask, and it's totally okay if this is not like a subject you want to get into, but in terms of like, obviously marijuana usage is becoming more of a thing because it's legalized around here. I know that, kind of side effect of using medical marijuana can be dry eye, getting like stuff like that. Have you seen any negative effects from your standpoint in patients who use medical marijuana?
That's a great question. And saying, people are coming in, and what's really interesting is we always ask that question. It's one of the things when you have an exam, you have to ask you smoke, you use alcohol, do you use any recreational drugs? And we've been asking that for, 15, 20 years. And, before it became legal in Michigan, we just had like 0 people would say that unless they were, teens and low 20s would say, yeah, I use it sometimes. Now it's incredible how many people in their 40s and 50s. Oh yeah, I've used it forever. You didn't tell us that last time, but it's just one of those things. But not really as far as it'd be just mainly with the dry eye with the smoke. And saying just, this anything with cigarettes, anything with smoke going on, not any problems that way. People have said, hey, it makes me feel better. We have a patient with a closed head injury that she did not use it. Her boyfriend used it recreationally. She said that when she used it, her eyes actually felt a little better, but it was a short acting little thing for about a half an hour, and that was about it. And she says, I don't want to use it that much. She was trying just some CBD oils, and that did not work. But it was the THC that helped out. People will talk about, well, let's use this because it'll, I can use it for my glaucoma, and saying, yeah, those studies are from the 1960s. It's true, they will. And the thing is that it will lower your eye pressure for about 3 hours.
Okay.
And so you now have to use 7 to 8 joints a day to lower your eye pressure. And so
Depends on how you're using it, I'm sure.
Yeah, we don't want you to use that much. You're unfunctional. It's if we could just use 1 drop a day. But as far as headaches, I've heard some great things about it. That people say on certain types of headaches, especially tension, it'll work. And saying, hey, if it does, I have no problems with that at all. I mean, it's a medication. I consider it a medication.
Yeah, cool. Thank you so much. I appreciate
it. Okay. Anything else? Because actually what it was going on to, we'll talk about the dry eye. I was going to go out for dry eye testing. There's a whole gauntlet of new things out there that we're using. And saying most of the time when people go in and you're going to get dry eye testing, they put the little orange drop in your eye, or we take a look at your lash, we take a look at your lid. There's also another one called lissamine green. It's a little green dye we put in your eye. Those are just, we call them vital dyes to let us know if any tissue is damaged or not. We'll look at how thick your tear meniscus is. That's that little tear pool at the very bottom of your eyelid. Gravity pulls it down. We want to see how thick that is. We take a look there. We also will do what we call a TBUT, tear breakup time. Put the little orange dye in, have you blink and keep your eye open for as long as you can, and we see on how long that dye lasts in your eye, because that colors the water part of your eye, and that's what evaporates. That's why you blink all the time, because you want to blink. Your eyelids produce the oils that cover that water, and back 20 years ago, they said most dry eye was secondary to you didn't have enough tear in your eye. Well, they were talking about water, but we found out more. It's actually more with the oils. And if the oil isn't there, that water evaporates very quickly. And so that's another quick little test we'll do. The other one is, if anyone heard of the Schirmer test, there's also what's called Schirmer or tear flow, or now it's even a phenol red thread test. That just checks the amount of tear you're making. We numb your eye up with a little drop and then use this and just see how much your basal tear goes in about 5 minutes, and that helps us out. Some of the new stuff, there's a thing called Tear Lab. Now this kind of sort of tests the saltiness of your tears. And if their tears are a little salty, it means you have a little bit too many things in there, not just it's getting too heavy. As molarity goes up, inflammation goes up, that creates dry eye. So we can use that. We use that before, we use it during your treatment to see if what we're using is helping. A pretty quick little test. Another one, if you've heard LipiVue, Lipivue, it looks at what's called the Meibomian glands. Now I looked this guy up back, he lived back in the 10th century. His name was Meibomian. If his name was Smith, we'd call him Smith glands, but they're the glands for your oils. You pull your lid down and sometimes you can see very tiny little yellow streaks on the back of your lids. Those are what we call the Meibomian glands, and those are the ones that secrete the oils to cover your tear. And this looks at those glands to see how healthy they are, to see if they even patent, to see if they're even open. And then if not, then we can do testing with that. There's another test called the tear microassay test. This looks for protein in your tear. There's a protein called lactoferrin that they've found that if you have this and it's too high, that's a sign of inflammation. And we say a lot of problems with tears are secondary to inflammation. So a lot of times we'll start people, I'll start them a lot quicker on anti-inflammatories, especially low dose steroids. And we have some really good ones out there. Like I was talking about Lrex that we use. We'll do that temporarily just to knock down the inflammation, and then we can start treating it. Because if you just try to use artificial tears with inflammation, it's not going to do anything. It'll wash it away, but it won't always clean it up. Another one is called Inflammadry.
Start the next one.
Yeah.
We'll just take a look at this.
This one looks for something called MMP9, which is another long protein in there. We're looking again at the saltiness of the tears. It works very well. Again, it's something to do when we're first testing and then later on just to check for it. So besides all those little dyes that we're using, we have all these new techniques to confirm our diagnosis. Is it evaporative? Is it just the water out, or is it the oils, or is it something too salty? And we can treat all those different ways. Any questions on that one?
I have a question, but it's not on that.
Oh, okay.
If that's okay.
Yep.
Do you think someone mentioned omega-3s a while back? So I take TheraTears. It has that in it, and then I take that like so many days a week, and then I'll take krill oil pills 1 day a week. I've been told to take the krill oil. Do you think that would help? Do you think that helps the Meibomian glands?
It does. It does. I put people on omega-3 fatty acids a lot, about 1,200 milligrams. Now, what you have to do is when you look at your pills, it may say 1,000 milligrams of fish oil. And people say, oh, you said that. And I said, no, I said omega-3s at around 1,000 to 1,200. So one 1,000 milligrams of fish oil, most of them only contain about 300 milligrams of omega-3s. So you've got to take 3 of those a day. So people, when I said 1,000, they're taking 1,000, but they're really only getting 300 omega-3s. They're taking 1,000 of fish oil, but the omega-3 content is only there. So you wherever you go, you can look at Zerbos and Livonias as excellent place to go. Anything natural, better health. Sometimes people say GNC, and I said, well, the people there are not always nutritionists. I like to talk to a nutritionist about that.
Yeah.
My wife gets one. It's actually out of Sam's Club. It's a 1,400 milligram fish oil, but it's got 900 omega-3s. I said, well, that's pretty good, because now I can just take, instead of taking 3,000 fish oil, I can take 1,400 and still get close to my 1,000 milligrams of omega-3s in there.
Yeah. So you should take about 1,200 or 1,000 of the omega-3.
Omega-3, yeah, take the omega-3. Some people have told me they found this new one. It's a 369, so it has the omega. I said, no. We just want 3s. We get enough in our diet of the 6-9s. Those are more pro-inflammatory. We do need some, but we get so much in our diet. Our ratio of the 6s, 6-9s are too high to the 3s. We want to build up the 3s.
And where did you say your, go ahead.
Yeah, well, my wife, she got it at Sam's Club, but I think now she might get it at just pharmacy, but you want to take a look at the omega-3 content on that. And that's another thing I was going to talk about with treatment. And every treatment, if you keep getting on it, we do this and then we put you on omega-3s, and do this and put you on omega-3s, and saying they do help. It's a generalized anti-inflammatory. And actually, it was really kind of cool. I was listening to a radio talk show, and they were talking with the nutritionist, and they asked her, you can only take, we're going to put this to you can only take one supplement. That's it. You can't take a multi anything. You can only take one. What would you take? Would you take vitamin C or vitamin D or an iron or magnesium? What would you take? And she goes, oh, omega-3 fatty acids. It was just kind of like a no-brainer. And then she explained it, because it's a whole body anti-inflammatory, great for fibromyalgia, and it reduces inflammation, and then everything else can work better. So D's great for this, C's great for that, iron's for this, omega-3s are just generalized. And I think that's probably the best explanation I've heard of it.
Wow, that is terrific. Yeah, that was very interesting.
Yeah, cold water fish, krill oil. It's the fish get their omega-3s from eating krill. So you just take the krill and leave the fish alone. And that's good. They're now trying to farm krill, just to have these great big farms, ponds with krill in them. And because the krill get theirs, they develop theirs from sunlight. And saying, so this way we don't have to harvest the fish anymore.
Well, some of the farm fish, though, isn't as good as the wild caught. So I'm wondering if that's true about the krill.
Yeah, that's I don't know, because they're still working on some of this farming of the krill. They're not down to it yet. They're doing some more of experimental with it. So what it's going to be? Yeah.
All right. Thank you.
Oh, you're not on mute anymore.
Oh,
So.
oops. Thank you for popping in, Janet and Bob. I was muted. Sorry about that.
No problem. As I say, you're about ending again, aren't you?
Yes, I'm glad you mentioned that. We have 6 minutes left. So I don't know if you guys wanted to go to number 3 or just end the session when time runs out. What do you think, Cheryl?
You gotta go.
Well, we're leaving, because I have to go for my eye doctor appointment. And Dr. Houdek was very nice talking to me here. I'm gonna get my Eylea shot. So so we'll talk to you guys later, okay?
Yep.
Take care, guys. Stay
Thanks.
safe.
Bye.
Yep.
Thank you
bye-bye.
again. Bye-bye.
Yep.
Bye.
Thanks.
All right.
Now, if somebody, I'll just explain about he says about Eylea shot, and people go, you get a shot in your eye, and saying they've been doing it now. And some people go once a month, and you go, how can you do that? It's going to hurt and pain, and saying, actually, the white part of your eye does not have many pain receptors in it. They put just a little numbing drop in your eye. The same thing when we do certain just office tests, the same drop we use here, and go in. The first 1 or 2 times, it's a little uncomfortable, but there's not a lot of pain involved. And they put that right inside the posterior part of the eye, and the fluid goes in to reduce inflammation. And they work really, really well. There's about 4 different ones, and it's saved millions of people's sight. Diabetic retinopathy and macular degeneration, blood vessels that are broken, branch occlusions and stuff. This stuff is just fabulous. But people say, "Oh, you're getting a shot?" And I'm just going for my shot, my eye shot. People think vaccine stuff. You get this one. So it, with the omega-3s, that's one of the biggest things. The other thing is also bilberry, taking bilberry. It's another nutritional or a B6 complex. So as far as nutritionals for dry eye, bilberry, B6, omega-3s.
That sounds good. I was just reading this article just real quick. I didn't finish reading it all, but it had some research in it. It was researching about children who ate fish. The study was done on, I think it was Chinese children, not Japanese, but it was very interesting. And they found out it really did help children, I think it was their IQ, or I can't remember exactly what it said, but they did denote how fish did affect. So, I mean, your omega-3 would be in that, that's what made me think about sharing that with you. So I thought it was quite interesting. I mean, it was all done by researchers.
Yeah, it's cold water, and it's highest in cold water fish, like salmon, tuna, trout. Sardines are one of very, very high in it. And you're going to love this. The fish with the highest omega-3 content is anchovies, but people step that down to sardines are wonderful. And they say like a can of sardines a week, or 6 to 8 ounces of salmon a week. You don't have to eat it every day.
Yeah, I do. I actually do that. Oh, I'm sorry, I interrupted.
No, that's wonderful.
Yeah, no, I have a can a week of sardines. I didn't think I could actually do it. I thought, I don't know if I can eat them, but and then we do have wild caught salmon like once a week. But a friend of my husband, he's very much, I think he and his wife it sounds like they're very much into nutrition. I don't know him that well, but he has like 3 cans of sardines a week, which I think is terrific. So he's got to be very healthy.
I wouldn't mind doing that if my wife let me, but
my dad lived to be 94. He loved sardines, but my mom hated the smell. So she said, "You want sardines? Go out in the backyard and eat them." So he went out on the picnic table and had his sardines. But
the other thing is also fermented food. So it's
like sauerkraut or that.
Sauerkraut or kimchi, and it's even the pickles and stuff like that, and saying fermented foods are wonderful for anti-inflammatories.
Oh, that's good to know. I mean, I hear that they are good, but it's easy to avoid them. Yeah, it's not something like it's on your shopping list.
Right.
I'll buy kimchi today, or